It's clear now that COVID-19 is not going away. As we learned from my recent conversation with Dr. Paul Alexander, the vaccines don't work to stop the chain of transmission, so they can never extinguish the pandemic. New variants will keep emerging, and there will be seasonal ebbs and flows of the disease. Yet for nearly 2 years, the public has been taught to be in a state of constant panic, to be hyper-risk averse. This also is not sustainable. Joining us now is the perfect person for this discussion, Dr. Aruna Tummala, a board-certified psychiatrist and also a pioneer in a field called integrative psychiatry. Dr. Tummala, thank you so much for joining us today.
Hi, Cindy. How are you?
So I wanted to talk to you specifically about the two issues I raised. Clinically, what psychiatrists are seeing and what they're doing about it, and also what you see as a better way to approach and live with COVID moving forward. So let's start with the clinical trends. What can you tell us?
As expected, we are definitely seeing that the underlying epidemic or pandemic, if you will, is actually the mental health pandemic. Right from the beginning, with all the policies, with all the panic and the fear that set in, we in the mental health field did anticipate that we will be seeing an increase in depression, anxiety across the age spectrum. And unfortunately, we've not been wrong. A recent study also found an excess of over 100,000 deaths with regard to opioid overdose. And opioid overdose and other drug addiction indices are also indicative of the state of unrest, mental unrest, if you will, that we are seeing in our society today. So across the mental health spectrum, we are seeing an increase in many different illnesses in the past year. And the second issue that you talked about is how are we responding to this crisis? And this is where I have really chosen a different path my journey began many years ago. But it really, the time for the kind of medicine that I practice, I think is now. So the typical response to this crisis has been to treat with psychiatric medications. Once we start doing this, in terms of starting somebody on a medication, the end goal, or how long are you going to take a medication, that is never really discussed. And early on in my career as a psychiatrist, I began to realize the harms that these medications actually pose to people, and the benefits are very, very overstated. So the harms are understated and the benefits are overstated. That is what prompted me to look at mental illness and its treatment from a very different perspective, from a holistic perspective. And now with COVID, what we are seeing is that it is actually the health of our immune system that determines whether you're going to succumb to this virus or any other infection. And it is, once again, the health of our immune system that helps us cope with stress. And many, many new studies have shown that depression, anxiety, psychosis, schizophrenia, autism, across the mental health spectrum, it is actually inflammation and immune system disturbances that contribute to these mental illnesses. So it's not a surprise when I see studies coming out that says that people with schizophrenia or bipolar disorder are at high risk for adverse outcomes with COVID. That's a no-brainer for somebody like me who does not see a difference between somebody having an infection or somebody having hallucinations and depression. To me, they're all manifestation of a disease in the whole mind-body system. And that is what we need to address.
So let me just ask you about the prescription of psychiatric drugs. Now, presumably people have anxiety, they're depressed because of all the changes in their environment that the pandemic has been inducing. So what I want to know is, are these psychiatric drugs the correct solution to their problem?
So from my perspective, the use of psychiatric medications itself is predicated on a very, very flimsy theory of chemical imbalance. And especially now with this whole issue with COVID, what we are seeing is that it's a psychosocial stressor that is giving rise to all of these mental health conditions. And yes, that does create an imbalance in terms of how our neurons are talking to each other, how our adrenal system is talking to the brain and vice versa. But how is taking a pill that is going to adjust your serotonin levels or dopamine levels actually going to help you to cope with what's happening in the outside world? The only way it's going to do that is by numbing your experience of what's happening. It's not going to give you coping skills. It's not going to improve your stress resilience. It's only going to numb. And this is very big pitfall with modern psychiatry. It numbs our patients to their life's experience and it actually robs them of an opportunity to delve into why they are having these issues at this point in time in their lives. So there's a very psycho-spiritual aspect to it as well. We know from a holistic integrative psychiatry perspective that there is a better way to address mental health issues. And guess what? This one way of balancing your immune system, bringing your whole mind, body, spirit into alignment is also the same response for dealing with COVID as well.
Can you explain that a little bit more? That sounds very interesting.
So what I stumbled upon when, in my own career, what happened was that I became very jaded with the practice of psychiatry. I was doling out medications month after month to new patients, but I deep down I knew that they were not getting better, but I did not have any other avenues that I could use to help them until I discovered holistic medicine. And then all of a sudden, I began to recognize the role of nutrition, the role of the gastrointestinal system, the role of the immune system, the hormones. And it was an explosion of education for me, which I brought back to the patients that I was seeing. And in addressing illnesses in this holistic way, I found that it is actually the health of the immune system that is crucial for health of every other organ system in our body, including the mind-brain system. And of course, when you're talking about the immune system, this is what is at stake for people that are succumbing to COVID. Early on, it became clear, I don't know if you remember the term cytokine storm, that cytokine storm was actually responsible for the mortality and morbidity that we were seeing. The COVID virus itself was not directly killing anybody. What was happening is that the immune system's response was being triggered into a cytokine storm, which is an over-exaggerated immune response that then attacks the body's various organ systems and results in death. And why the cytokine storm happens is actually because of chronic medical disease, like obesity or heart disease, high blood pressure, and high cholesterol issues. These are the underlying factors that actually increase your susceptibility to COVID infections. These are the same factors that will increase your susceptibility to depression, to anxiety, to dementia, all of these conditions.
Be sure to watch the entire episode, now available exclusively at EpochTV.com, a new completely censorship-free premium subscription platform. Brought to you by the Epoch Times. See you there.